Well, it's time for our health report, and joining us now is Africa 54 health correspondent Linord Moudou with a look at World Water Day. Linord.
That's right. Experts from around the world are gathering this week in the Swedish capital of Stockholm for World Water Week to discuss and develop new solutions to the globe's most pressing water-related challenges. The theme of this year's week is Water for Sustainable Growth. Observers say 2016 is a critical year for addressing the role of water in the post-2015 development agenda. The UN's Sustainable Goal 6 calls for universal and equitable access to safe and affordable drinking water by 2030. The U.S. Centers for Disease Control and Prevention says worldwide 780 million people lack access to an improved water source. Unsafe drinking water, inadequate availability of water for hygiene, and lack of access to sanitation together contribute to about 88% of death from diarrheal diseases. Now joining us live via Skype from Madrid, Spain, is Dr. Martin Mengel, Program Leader of Enteric Diseases with Agence de Médecine Préventive and Project Director of the African Cholera Surveillance Network, AFRICOL. Dr. Mengel, thank you so much for joining us.
Hello, Lena. Thanks for having me on the show.
So first of all, this is World Water Week. Why is it important to put an emphasis on water in such a week?
Well, water is the basis of life, and water is also the basis of health. And at that, it's a public common good, and it's the right, a human right, to have water. I think there's probably hardly a good or a commodity, if you want to call it that is more important than water. And in the absence of it, there are many diseases, primarily diarrheal diseases, that are transmitted and that large parts of the world's population still suffer from.
So what is the picture? Can you describe for us what we are seeing, especially in sub-Saharan Africa, in terms of some of the waterborne diseases that are common?
Well, I think there are the most recent estimates for life years, disability-adjusted life years averted. Meaning a year of a person's life that a person cannot live in perfect health due to the absence of safe water was 26 million only in 2010. Or if you want to put it another way around, there are thousands, hundreds of thousands of deaths that occur due to water-transmitted diseases, large parts of them due to diarrheal diseases, and the absence of safe water contributes to, I think the recent estimate is 88% of all deaths due to diarrheal disease. And
Dr. Mengel, we know the solution when it comes to clean water. I mean, this is an issue that has been discussed for so many years. The solutions are there, we know them, but the issue is still remaining. Why?
Well, I mean, in the early 20th century in Europe, we had the same situation that we still have in sub-Saharan Africa or Southeast Asia. And we did a simple thing. We built canalization and we built piping systems that would bring safe water to everyone. The same thing needs to be done in the entire globe. But still, although we know this, and though it has been formulated in the Millennium Development Goals that existed up to 2015, sub-Saharan Africa was the only region in the world to fail the goal of increased access to safe water. I think the problem is that the societies will need to consolidate and that the political will needs to be mobilized to actually make this happen.
Okay, Dr. Mengel, that's the time we have for today. Thank you so much for joining us. And that was Dr. Martin Mengel, Project Director of African Cholera Surveillance Network, AFRICOL. Now, healthcare is one of the most challenged sectors in many African countries. Challenges include insufficient numbers of healthcare workers to poor infrastructure. However, through the AfriHealth initiative, the continent hopes to salvage the situation before it escalates. Saving lives, providing comfort. So many African health professionals lead rewarding careers. But there are times when doctors and nurses here are faced with serious challenges. Medical workers in some African countries have complained about issues such as lack of access to proper equipment and medicines and low pay. Consequently, many healthcare workers choose to become expatriates in hope of better lives and working conditions.
We have a serious shortage of health workers in Africa, and it is reported by WHO that 6 million health workers are needed from all the world. So how can we address that? We don't expect miracle. We don't import doctors from anywhere else. We have to work together.
It is against this backdrop that the Medical and Nurses Education Partnership Initiatives, MEPI and NEPI, was formed 6 years ago to revitalize education and address the pressing health needs of sub-Saharan Africa. Beginning September 2016, the initiative will be known as the African Forum for Research and Education in Health.
We're very excited by this transition, firstly because it really brings together two very powerful professions in the response to health burden within the continent, the doctors and the nurses.
Brain drain of health professionals and inadequate health systems are some of the problems AfriHealth aims to address.
If I don't get a training opportunity in my country, in my continent, I go to another country for that, and the chance of me coming back to my country is less because I get used to an affluent society living style, and that's another thing. So we should have, so everybody wants to learn and improve himself, and that has to be arranged in the country or the continent.
The World Health Organization says that the world will be short by 12.9 million healthcare workers by 2035 if many more are not trained and employed. Africa has 2 healthcare workers per 1,000 people, compared with the Americas, which have 24 healthcare workers per 1,000 people. 17 African countries participate in the AfriHealth initiative, which brings together over 200 health professionals. Countries in this initiative come from East Africa, Southern Africa, and a few from West Africa. Now, through AfriHealth, educating an adequate amount of new health workers can address the manpower issue before it becomes a continent-wide crisis.